Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Hey, docs, welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I'm excited to bring on Dr. Manuel Astruc, who is our resident doctor of the mind, and he is an MD, and he works a lot with patients on all things mental health. But he also works with entrepreneurs like myself, and I worked with him directly for over a year. And we have him coming to speak to our East Mastermind group, actually, the weekend of July 18th. So a little bit, I think right before this episode airs, to talk about how to prevent professional burnout. I think one of the things we try to really work with our clients, whether it's in our coaching or in our mastermind, is how to push the envelope effectively, have great work-life integration, and how to prevent burnout and enjoy what you're doing. Yeah, you got to work hard, and that's kind of the table stakes of being a doctor. And so having an expert on our podcast here every few months or so to tackle different topics has been great. And this particular one was actually an idea of one of our coaching members, and was, what are some of the different personality traits out there? And we're talking about things like some folks are a little more have they higher anxiety than others. Some might be a little more OCD than others. Some of them a little more regimented. What are some tactics and strategies that folks with different personality types or different nuances can do to help still be great at what you do, own a great practice, provide great leadership to your patients and to your team, and also, again, protect your mental health and to function at a very high level without the negative consequences that we often see in the healthcare field for doctors, not just chiropractors, but doctors in general. And this was a great episode. Always love bringing Dr. Astruc on to talk about these topics because it is outside of my expertise, but it is in his wheelhouse. And again, that's why we bring him on here. That's why I worked with him, and then that's why we are bringing him to our mastermind group. So without further ado, here is my interview with Dr. Manuel Astruc. All right. Excited to have Dr. Manuel Astruc on the podcast today. He is our resident expert on all things mind, we'll call it, right? And you've been on the show before, and you've been my leadership coach in the past for a year, which really helped me kind of navigate all these things that we have to deal with as an entrepreneur, as a business owner, and frankly, as a provider, healthcare provider. We have a unique set of circumstances, I think. And today we're going to dive into different types of things that business owners might deal with. Maybe they're a little bit on the higher anxiety type aspect. Maybe they're a little more depressive, maybe some OCD stuff. What do we consider with these groups? And we'll dive into some of those. But before we do, for maybe our newer audience, tell us a little bit about yourself, your credentials, and then we'll dive into it.
Yeah, so I'm Manuel Astruc. I'm a psychiatrist. I've got a full-time private practice in general psychiatry in Saratoga Springs, New York. And I've been working on scaling out my practice, becoming an entrepreneur with it. And part of what I love doing is helping entrepreneurs. I'm the person who helps you to perform at your best without getting overloaded.
No, absolutely. And I do want to mention it. We had in the past, but you had a great book that came out. Has it been 2 years now with the book, Happiness Rules?
Yeah, so October will be 2 years. Yep.
Oh, good. Yeah, it was a great read. It's an easy read, but very informative and just gives you a lot of insights on what that looks like. I think as you read it as an entrepreneur, it's so important because we have so many good, positive aspects of being, a doctor or at some point a business owner, but it's not easy. But that's part of also what makes it worthwhile.
Yeah, absolutely. Besides taking care of yourself, you're taking care of patients. You've
Mhm.
got staff, you've got family. There are so many demands on your psyche and your time.
There is, and I think, we sometimes forget about that, and we had the question posed in our coaching group from one of the doctors about this particular topic because it was insightful. We were talking about mindset stuff. We weren't diving into clinical things, but just talking about it. And the particular doc was just talking about how really likes checklists, and maybe it's the OCD part of me. Just kind of said it in passing, and then we kind of chatted about the different types of things that people do have their tendencies, and what does it look like to manage some of that. And so I'd love to dive into a handful of these. Sound good?
Absolutely.
The first one I want to actually dive into, it's is empathy, right? I think one of the things I've heard from chiropractors that are empaths, I guess you would call it, or super empathetic, can struggle sometimes as a doctor, taking on their clients or patients' issues, or even their team members' issues, or just the whole thing. What are some of the insights and thoughts around empathy and how to manage that?
It's a great topic. As as professionals in the healing arts, the ability to relate to your patients, to really put yourself in the patient's shoes and to understand what they're going through, um, is really important to establish rapport and a therapeutic contract, as people are kind of opening up to what they're going through and what their struggles are. And the challenge is, to maintain a healthy boundary so that at the same time that we're stepping into their shoes, we're not stuck in their shoes. We're not
Mhm,
taking on more than what is ours to take on. Um, in psychiatry, we worked with so many patients so quickly, that it was one of the things that was focused on, early on in our careers,
mhm.
with people in terrible situations.
Okay.
And in chiropractic, care, people with chronic pain,
Mhm,
through no fault of their own, who've had an accident or trauma of some sort. Um, and you do have to work to be super understanding, but at the same also in your professional hat in assessing and diagnosing and coming up with a treatment plan, um, not staying stuck in their shoes. In psychiatry, we were inundated with patients from day one. We were right in the wards and with, seeing patients, one to one. And what we learned very quickly was that you had to establish that rapport. You had to be in the patient's shoes, but you were also at the same time in your professional mindset, stepping back and assessing, diagnosing, coming up with a treatment plan, and the ability to fluidly go back and forth and maintaining that level of your professional identity and your relationship to the patient as a professional who's treating,
mhm.
um, was very useful in avoiding getting too deeply into empathy where you lose, um, really the proper emotional distance from the
Mhm.
patient.
Yeah, and if because I hear some people say it's like they take the cases home with them, right? They wake up at 2 a.m. because the one patient isn't getting better, or they maybe even got worse with care or whatever. Um, I wonder, is there any type of strategies that you've incorporated or learned to when you do leave that office to be able to almost do like a an unloading of everything out of your brain, and then walk into the house and not think about that stuff? Is there anything a person could do to potentially manage that?
Uh, so that definitely happens,
Mhm.
and the longer that you're in practice, less that it tends to happen.
Yeah.
Um, but I think again, it's coming back to that professional identity of, that's my professional hat. I'm worrying about this when I'm at home, and I've got to leave the practice at the door when I walk out of the door. So the thoughts are going to come up. We can't, help where the mind goes, but rather than digging in and continuing to obsess and to focus on that, I think it's not getting rid of the thoughts, but refocusing on, whoops, I'm in my, parent, husband, wife role right now, and that doesn't belong here.
Yeah, and I think what you had a great insight is that as you do progress, I'm in 19 years now, you definitely don't think about it as much as when you do when you're early on. So if you're listening to this and you're in the first handful of years of practice, it might be a little bit more, than you were hoping for as far as dealing with it outside of practice and thinking about it. But as you do get along and you get a little more experience and you realize that you're going to help a ton of people, you can't help everybody, and you're never going to have a 100% success rate. You do get a little more numb to it. So I think that is good advice. And I think another thing that I've found helpful for me is that having colleagues that you can talk to about particular cases, if it's just one of those ones that's really getting to you a bit, talking to them a bit about that. I found that to be helpful for me in the past.
It's really interesting when you're working in a private practice, you can get very isolated, but having people that you can call or text or periodically touch base with just some kind of peer supervision, is very, very helpful.
Yep. And we've seen it within our different groups that we have of chiropractors, whether it's our coaching program or mastermind, be it the clinical or the entrepreneurial aspect of it, having those colleagues and sounding boards and things of that nature are really, really helpful when managing some of that. So I think that rounds out. I'm sure we could probably do a whole episode on empathy, but we're gonna tackle a handful here. The next one, I think in society, again, I'm not the expert here, but we're seeing a lot higher levels in general of anxiety. And I don't know what all the reasons for. I know there's a lot about it, but some people are going to definitely tend to be on the little more higher end of anxiety. And if you are a doctor and or practice owner, it could be a little bit of a struggle there. So what are some of the initial thoughts there on anxiety? And then we can kind of workshop this for a minute.
And so anxiety is a very normal human emotion. And when we talk about anxiety from a psychiatric perspective, there's a gradient or a scale of kind of normal anxiety, and at some point where it starts to cross a line to something that may require a little bit more support or treatment, with talk therapy or
Mhm.
medications or whatever. But that line is two things that we always talk about. It's a functional impairment due to the anxiety, um, or a significant amount of emotional distress, um, which is defined by the individual who's having the anxiety.
Mhm.
But up to that point, and even past that point, looking at number one, generalized anxiety. So generalized anxiety is where our brain is chewing on things, and it's hard to stop it,
Yeah.
and we're making mountains out of molehills.
Mhm.
And the fact that we have that insight, I'm making a mountain out of a molehill, doesn't stop the brain from doing its thing.
Mm.
Um, and then there can also be things like panic attacks.
Yeah.
Um, and panic attacks are defined as kind of a discrete episode of anxiety that's generally out of the blue, where you get just a ton of adrenaline flowing through your system. And there can be specific situational anxieties related to, a patient who really gets under your skin, who's kind of a hard person to deal with, or a
Mhm.
staff member, or an insurance company, that we just get that phone call or the message pops up and we're like, oh my gosh, I dread this, right?
Mhm.
So there can be specific anxieties around those.
Yeah. No, that makes sense. Like I would say I suffer from a pretty good low to moderate anxiety level where kind of like I can't shut my brain off and thinking about things a lot. But for me, fortunately, I guess it actually drives me into action to work on whatever it is that's going to resolve that. I've been known over the years to be up at 2:30 in the morning with a cup of coffee working on it, and then going back to sleep for a couple hours before going to the office. I haven't had to do that in a little while, which has been good, but it does drive me into action. So a lot of times I've kind of learned to recognize it and know it's like, okay, probably need to take action on something. But I think for some people, the anxiety drives them to inaction. Is that something that you often see within that anxiety? Some people take action on it. Some people, it kind of paralyzes them a bit.
Exactly. So the anxiety can lead to a paralysis and an avoidance of the problem, which ends up just making things bigger. That's one of the functional impairments of anxiety.
Mhm.
You get paralyzed and you avoid doing what you need to be doing. Um, our brains have what's been recently recognized as a series of connections called the default node network. Um, and when you're asked to relax in an MRI, a functional MRI machine, just don't think about anything. Um, they see these connections light up within 5 or 10 seconds. And this is your brain at rest, where it just starts to be on autopilot, and it generally just comes up with all the things that you can possibly worry about. Um, so left to its own devices, our brain is geared for survival, not for happiness.
Mhm.
Uh, so we can take back control of that with intentionality. So whether the intention is kind of putting your focus back on, today, what you need to do today,
Mhm.
whether it's, taking action on things. But uh, when we're on autopilot like that, and oftentimes as we're going through our day with time constraints, patient constraints, uh, our brain is on autopilot as we're pushing all of these things through our practice, um, and we can be left with just a lot of worry in our head.
Yeah, I was at the Coach Con a few weeks ago, and they had a topic. It was a presenter who's on leadership. He was an ex special forces guy. He's probably about my age, maybe a few years older now. And then after he got back from, he was in quite a bit of combat, and he ended up getting his degree in psychology, and he's kind of done a lot of with leadership now. And he was one of like 25 out of the 250 that were entering in to become that special forces. Only like 25 of them made it out of all that. And it was a very extensive, long program, as we all know, with these special forces. And one of the things he said was like because they were all physical freaks, they were all mentally tough, they're all like, the cream of the crop going into it. But they really said like the ones that actually made it, one of the key things was is they were able to just focus on what they had to focus on that day. The ones that ended up dropping out a lot of times, they were like, today was so hard. I can't imagine doing this for another day, another week, another year, because it was like a year. They just couldn't imagine doing this again. Whereas the ones that could just say, you know what, I just got to make it through today. Just got to make it through today. Just focus on today. Tomorrow I'll focus, like they were able to stay in the moment versus projecting out in the future. And something I've read in the past where it's like those that dwell on the future is where they get the anxiety. Those that dwell in the past, maybe a little more of the depression. I'm not sure how accurate that is, but it was interesting hearing him talk about that. And and he's like, those that could stay within a parameter of their mindset, not get too high, not get too low, stay within a narrower bandwidth there, and focus on the present, didn't have the anxiety about the coming days and weeks of this grueling, test of trying to become special forces.
And Kevin, there's a everyday example. So you're someone who works out regularly, and when you're going into a hard workout or you're in the middle of a hard workout and your brain wants to quit, right? Like
Mhm.
this sucks today, right?
Yeah.
My muscles are burning. This is hard. The more you focus on how terrible you're feeling, the harder it gets, right? So we all develop kind of little tricks to just kind of focus on counting out the next rep, counting out the steps. I when I was doing the stair steppers, I would count like 10 steps and then the next 10 steps. But the last thing I could do was be focusing on how hard
Mhm.
I was going and how long I could last like that.
Yeah, it's exactly right. And I got to get a little bit better at that. But because I see some of these folks that do like, CrossFit, some of the really hard stuff. I had a patient that ran like 200 miles for this. thing. I was like, God, like that's mental strength for sure. But on one little another part of this anxiety topic, and again, I'm not an expert in it, but I was listening to an audiobook about it. And they were talking about where some people have a unhealthy relationship with what they think is anxiety, and it's actually just kind of like it's just discomfort, right? Almost everybody's like quick to label things now, like, oh, I have anxiety. And it's really, if you really dove into it, it's it's just kind of a normal, like sometimes we don't always feel great. And sometimes you just have to sit in it a little bit, quote unquote, and work through that a bit. It doesn't mean you have an anxiety disorder or you're abnormal or anything like that. And it almost seems like everything's gotten talked about so much now that some people latch on to labeling anxiety when it's just really natural to that. If you're a doctor and you have to do a ton of patient notes all day and then you have to run a business, like there's going to be uncomfortable moments and it's not necessarily anxiety issue. What are your thoughts on that?
No, so that's exactly right. Anxiety is normal.
Yep.
Being uncomfortable through the course of our days, for whatever the reason, that's normal. Where it becomes more pathological is when you're starting to have that functional impairment or that high degree of internal distress. Um, it's become incredibly common that people come in and they've been listening to TikTok and they
Yep.
have an anxiety disorder, they
Yep.
have a dissociative disorder, they have, you name it, they
Yep.
found it on TikTok. Um, and people are looking to identify with others.
Hmm.
In med school, every time we came up with, we were studying a new disease, we all had the new disease. Oh my
Yes.
gosh,
Yes.
I have
Yes.
all those symptoms, right?
Yeah.
Um, so it's very, very normal for our brains to seek that tribe and to identify with um, what we're hearing. But you're absolutely right. It's not a disorder to have anxiety. It's
Mhm.
not unreasonable to be uncomfortable. Um, and one of the things that actually will drive worsening of symptoms is trying to avoid them.
Mm.
Um, so for, someone who's got panic attacks, trying not to have panic attacks is going to have more panic attacks. If you've got, a little bit of obsessing, trying to not obsess will it makes it bigger. You give it more energy, you're going to obsess more. So being able to, sit with uncomfortable feelings it makes us stronger, right? It
Mhm.
gives us more resilience. And we don't need to pathologize all the emotional experiences that we have.
Yeah, and that's something that's helped me with kind of, you know, working with you for like I did and then just reading as much as I do and actually when I came across that part of it, it's like, you know what? I'm gonna like dance with the uncomfortable feeling sometimes and realize, okay, yeah, it's just like a tough day, and this happened, and I'll feel better about it, but I can't avoid it, and you just gotta kind of sit with it a little bit sometimes.
Yeah, I remember, Seth Godin used to say, "Dance with your fears," right?
Hmm. Hmm.
Like don't avoid, just dance. And whatever it is that you're the most afraid of, that's what you should be pointing yourself at, right? Because you're
Yeah.
just avoiding it, and it's probably the next big breakthrough that you need to be making in your business.
Yeah, another speaker at the Coach Con, she was really good. It was more about branding, so it wasn't about necessarily like leadership and psychology, but she has a teenage daughter and she's we're talking about one of the parenting things that they have. It's like a whole thing where she, whenever her daughter is fearful of something, because she's like, I want to, when you're a parent, you're not raising a kid, you're raising a thriving adult, and she wants her daughter to do big things like she has. And one of the things she says to her daughter, like when there's, fear around something, the saying they have is the antidote for fear is courage. And, and that's sometimes we have to realize that like there's a lot of challenging things that we're going to deal with. And the antidote to that a lot of times is courage. Like we all have that fear or anxiety around things, and it's the courage to work through that is what's going to help you grow and develop as a person and obviously as a professional.
And Dan Sullivan's great line is, courage never feels good.
That's true. Yes. it's really true because like I think some people think that those that have a higher levels of courage think that it's like it's easy for them. It's like no, go working through that courage is not fun. Let's take a break from today's episode and announce our first sponsor. This is going to be Propel Marketing and Design. I've known Darcy Sullivan for years. We've worked hand in hand on my websites. I don't trust anybody else to do the search engine optimization. She does a great job. There's so much to it. A lot of the lingo and the words are beyond my comprehension, but it's just amazing work that she does. And if you're really going to get results with Google, you have to make sure your website is SEO optimized. And I really don't want you doing it yourself as a chiropractor. So you just have to have this type of stuff done. And if you're looking to get more organic online traffic that pulls in new patients, Propel Marketing and Design is currently offering chiropractors who listen to this podcast a free SEO website review. The free review will help you uncover methods that will improve your website and boost your search engine visibility. Head over to propelyourcompany.com/chiropractor and schedule your free SEO website review. You won't regret it. She gets great results. Your website needs this. Your search results need this. Head on over there to propelyourcompany.com/chiropractor to get your free SEO website review. That's great. All right. So I think we tackled anxiety well there. Let's move on to let's move on to depressive, but not I don't want to go into full blown like clinical depression. I think obviously if you've been diagnosed with that, if you've been dealing with that, the podcast is probably not the place for you to get your solutions for it. You want to seek out a professional like yourself, doc. But some people I think battle depressive moods or such that wouldn't necessarily be full on clinical depression, maybe. And you just have to manage some of that. Am I accurate in what I just said there, or can you give us some better insights on that?
No, so you're exactly right. So the personality styles and our interactions with the world,
Mhm,
we have the people who are just extremely exuberant and
mhm,
vivacious, and nothing ever gets them down.
mhm.
And there's a whole spectrum. If you get too high on that, then you're manic. But um, some people are just really happy people.
Yeah.
Other people tends to be more melancholic.
Mhm,
Um, or there's a season in their life where they're more melancholic, and it's not crossing the line into causing that functional impact or high level of distress. Um, and then the steps that we have are number one, kind of accepting where you're at, right? This is kind of how my personality tends to run. Um, we'll oftentimes compare ourselves,
mhm,
right? Like I
mhm.
wish I was like Kevin, vivacious and social and outgoing and
Well,
whatever.
thank you.
Um, um, but that comparison really is going to have us measure our shortfalls
Mhm,
compared to someone else, right? We're comparing our insides to someone's outsides, and it's best to really work on that, accepting this is kind of how I tend to function,
mhm.
um, and how can I flourish within this as best as I can.
Yeah. No, it makes sense. And one of the things I've talked with other chiropractors about, whether it's, let's say, a little more melancholic or a lot more introverted, is when you do hire, I like to get a little more extroverted folks, maybe a little more vivacious around them so that now the clinic has a good energy. When patients come in, they've got some folks that are on that, higher energy and extroverted type of path a bit. And I think that's helped some chiropractors as well.
There's a little bit of a hidden piece that also happens because for someone who tends to be a little more dysphoric or melancholic, and they're coming into work and they're trying to ramp up their energy to engage and to help patients. Um, what will often happen is that they're fried by the time they get home.
Yep.
Um, and then the family unfortunately suffers because they're not up to engaging and relating in ways that they could. And I think that, that's a place to have a conversation with your partner, your partner's home in terms of what you need to, kind of de-stress and transition
Mhm.
from, kind of your work mode to dad or mom mode, husband, wife mode, um, within the family settings so that you're kind of identifying that this is a legit concern that can be addressed.
Yeah, and one of the things we've done in my family is that, um, I mean, almost no matter what, like I'm tend more to introvert. Some people may say ambivert, if that's a real thing or not, but I can definitely turn it on. And when I'm in my practice, like I have a lot of good conversations and stuff, but it definitely drains me. And at night, I'm a little more challenging to kind of keep that energy going. I'm an early riser as well, and so I spend from 6 a.m. to 7:30 a.m. with my kids, and we're doing a bunch of stuff for like 90 minutes, and I'm really in tune with them. I've got my energy, everything's great. Then I get ready and go to work, and then when I come home, I still spend another hour and a half with them, but it's definitely a little more melancholy. And I'm not as, vivacious and talkative at that point after a long day, with patients and such, but, I found that that gives me a good 90 minutes in the morning, 7 days a week at least, um, to really, be present with my kids and such.
And you've had conversations about this with your wife, right? You guys
Yeah.
have a very foundational kind of good communication. So like it's not a weakness that you come home and you're a little fried. It's not weak. It's
Mm,
just how it is.
mhm.
And let's work on problem solving and talking about it and um, not trying to be something that you can't be or also having expectations from your spouse that, oh gosh, you're finally home, like take over.
Yeah, yeah. And I also have drawn a pretty good line where I don't work on weekends. I mean, I travel on weekends and do some work, but when I'm home, I'm home on weekends. I'm not working and stuff. So that's helped out. All right, let's take a minute break from our show to talk about one of our sponsors, Genesis Chiropractic Software. And to do that, I have my great friend, Dr. Jay Greenstein, who's going to tell you about Genesis. Doc, how you doing today? I want you to give us a short understanding of what Genesis software has done for your practices.
Kevin, I'm going to make it super easy. It's done three really important things for us. Genesis has made us more efficient because the system actually manages process instead of people. We are very, very efficient understanding what needs to get done, what has gotten done, what is not getting done, and what to do about it next. Secondarily, it's made us more information enabled. Because we can run reports and analytics right out of the system, we have so much information about the status of our patients. We have so much information about the status of our business that we can make much better decisions as clinicians and business owners in order to ensure we get the best outcomes and have the most income. And lastly, because of all of these great functions that Genesis has, it's made us more profitable because if we can be more efficient and if we are more information enabled, it means we don't need as much labor. And so for us, we've been able to actually eliminate entire positions like our front desk CA. We don't need front desk CAs anymore because operationally we are moving much more efficiently. We are managing the practice much more efficiently, and therefore we need less staff. All the people in our clinic, they are income producing, revenue producing people. And so we function in all of our clinics without the use of front desk CAs, and all of that is due to Genesis.
Thanks, Jay. And you can go to bit.ly/GenesisMCM to check out more. All right, let's go to our last one here. I know there's probably more, but we're gonna kind of just tackle these ones. And the next one is the OCD types. I think a lot of times with the OCD, they can be really good clinically. They uncover all the potential issues and really focus on that. But it can probably cause some issues there. What do you see with the OCD stuff and being a business owner slash practitioner?
Um, so it's really interesting. So people who are actually OCD, right? They actually have the disorder.
Yeah, yeah.
They're the most tormented people that I treat
Mhm.
because they've got really good insights. but they can't stop doing things that are driving them crazy.
Yeah.
And they're oftentimes very embarrassed by it and can't talk about it anywhere else. So if we step back from that level of distress, we end up with obsessional kind of personalities and personality traits. And I think that, one of the challenges there, the level of organization that can be super useful to keep your practice running, to keep yourself on track with things,
Mhm.
um, can also lead to a high level of rigidity with the people around you.
Yeah.
Um, so for people who tend to be obsessional, and um, I'm talking about folks who find it, soothing, right? So my
Mhm.
checklist and this is how I run the practice, and this is how you put the patients, in the room, and like it's got to be just so. I mean, it
Mm.
soothes them. They feel
Yeah.
way better when they're doing that. But it may be driving everybody else crazy.
Yeah. Yeah. I have a buddy that's like that, and he was like, he's like, "How do you let that be like that or whatever?" And I was like, "Well, it doesn't bother me." He's like, "That would bother me." I was like, "Well, I know. That's why you have to have it the other way." Like, it becomes like a vicious cycle of like, not like you said, the rigidity and not having the flexibility around margins of error that life is going to be, right?
That's right. There's always going to be curveballs. Like you can't avoid them.
Yeah, for sure. Um, what would be some strategies for that OCD? And again, not like to the where it's like off the charts, but even certain a level as an entrepreneur. I know there's probably some benefits to it, but is there anything they can do to try to manage it, moderate it a little bit, put some people around them? What are your thoughts on that?
Um, the understanding of the impact on others,
Mhm.
of the systems that they're developing, and then working to figure out what levels of flexibility they can have around that, um, is important. Um, my father was a very obsessive guy. It,
Mhm.
it kept him incredibly organized, but he had like zero tolerance for any
Yeah.
curveballs that came his way, and he was never really able to develop that insight.
Mhm.
Of stuff's gonna happen. This is planet Earth. There's gonna be friction. There's gonna be things that break. People are gonna be late. People are gonna
Mhm.
forget to do things. Um, and having that level of flexibility. There's a mindset that I heard years ago. Um, but when somebody messes up, like something goes wrong, to interpret what happened with the highest level of generosity that you can.
Mhm.
Um,
Mhm.
so don't think incompetence or deliberate sabotage or
Mhm.
it's people are generally doing the best they can, and then we can extend generosity to those around us.
Right.
It helps keeps our levels of stress better, and it just makes everything smoother.
Yeah, and one of my concerns with the chiropractor that falls under that kind of OCD and very, very, very rigid is they burn their team a lot. They burn them out. It's not joyful for them to work. Like it just becomes hard. And I know there's a fine line. Like you don't want, to have too much of a laissez-faire mentality around it and let your team and patients do whatever they want to do. But to have a little bit of flexibility around it definitely allows for a better culture and environment. But with obviously core values being maintained and such. But yeah, it's always a little bit of my concern with the
Yeah.
OCD stuff.
And the intensity with which we communicate to the staff, right? So
Mhm.
so when we're really frustrated because a system just kind of broke down, that may not be the time to address it with your staff member because that's going to come out like
Mhm.
with a high degree of intensity.
Yeah. Yeah.
So for me, I'll oftentimes just kind of make a mental note,
Mhm.
I didn't like how that went.
Yeah.
We need to make a change here. But I'll address it, the next day,
Mhm.
when I've had
Mhm.
time to process and I'm not so heated up about it.
Yeah.
Because I don't want to see my staff's face like
Mhm.
look at me like I've
Yeah.
just scared them,
Mhm.
or belittled them or came across too critically.
Yeah, this is great. Let's take a short break for one of our great sponsors, TrackStat. It is a new type of software plugin for your EHR that combines patient communication, marketing, automation, and statistics with patient and employee tracking. Built by chiropractors for chiropractors, it shows your team what to focus on each day. See patient visit habits, missing information, unpaid bills, insurance collection visit average, and more. Great visibility of data so you can focus on filling your office with your best patients. When you can see what your staff and patients are doing or not doing and take action accordingly, your profits naturally grow. Take TrackStat for a test drive in your office with our free trial. Not a techie, no problem, we can help. To get started on your free trial, visit trackstat.org and watch the demo. That is trackstat.org. I think overall, having some self-awareness around that and wherever they may find themselves struggling with any of these that we talked about is start to work through that. Obviously, if you feel like you're on the impaired side of it, seek a professional. But if you just, you're dealing with some anxiety, that's normal. Like, what can be strategies for you? I would kind of figure out where you may be having some of these issues, or not even issues, but just within these types, and start to get some self-awareness around it, understand it a bit better. What are some strategies that help offset that for you? Is there some hobbies outside of work? Certain people that I found, for me, one of the things I learned in my leadership development was just that certain types of people just are not a good fit for me. And I have to be okay with that and kind of move on and not surround myself with those folks. And that's been helpful for me.
And there's things you can do during the course of the day. We talk about active recovery. So, and in a busy practice, it's hard to find 5 minutes where you can just stop at 2 minutes, 5 minutes of taking some time to just do some deep breathing,
Mhm.
do a couple of minutes of meditation, do a couple of push-ups, jumping jacks, go outside, look at the sun, get some air. But oftentimes when we get a little downtime, we'll jump on our phones, we'll
Yeah.
do a little social media, we'll send a text, and really kind of that's passive recovery, right? That's kind of numbing out
Yeah.
rather than trying to do something that's going to energize and give us some of our energy back that we're spending all day long.
That's a good point. I've actually gotten in the habit now, like once or twice a day, I walk around, like I go outside of our office building and walk around. It's nice, a lot of greenery. And I take a walk, even if in June when it's hot as you know what, I still do it because it just gets me fresh air, gets me feeling better, hear the birds chirping, things like that. And it gets me in a little bit of a better state once I've kind of been a little bit stressed or just getting a little bit tired.
Yeah, yeah. So we only have so many units of energy, and we're spending them a lot with our
Mhm.
patients. So whatever we can do to get some energy back is useful.
Awesome. Well, this has been great. If they want to find out more information on how someone like yourself could help, how could they find you?
Yeah, so manuelastruc.com. That's ManuelAstruc.com. My website and has a lot of information there.
Definitely, and definitely check out the book. It's a great read, very insightful, and was very helpful for me in preventing burnout and things like that. So, highly recommend it. And Doc, I'm excited to have you come speak to our mastermind group in Chicago, our East Mastermind, on how to push the envelope but not burn out. So that's going to be cool, and we're all excited about that because we have a lot of ambitious folks in our mastermind groups, and it can be a fine line between, um, you know, pushing it and pushing it too far.
No, I'm looking forward. I'm so excited for that. It's going to be great.
Perfect. See you then, Doc.
All right. Thanks. Bye-bye.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.